on to Her Excellency Grace Akilo, Uganda's High Commissioner to India. Uganda's High Commissioner to India, for I should mention on a personal note, has been very proactive and really been very encouraging of this initiative, this webinar we are organizing. And madam, can you hear me?
I can hear you very well, thank you.
Yeah. And she has a gift for writing. She's apparently a great admirer of what India is, or at least how India is handling the pandemic and the lessons it holds for the Uganda and the African continent. Excellency, I would like you to focus in your remarks for 5 to 6 minutes maximum on this particular aspect, that what is the relevance, or how do you look at the Indian experience or so far the way India has handled the pandemic, and what lessons or what is the value of that experience for Africa. Also, I've seen that all the what we have done as acts of solidarity, for example, the lamp lighting, diya lighting, and all that. Uganda had created quite a buzz, and in other parts of Africa. How do you look at this cultural affinity, and going forward in terms of setting the agenda for India-Africa, the next India-Africa summit? Can you talk about some iconic projects that two regions can partner? Over to you, Your Excellency.
Well, thank you very much. First, I would like to thank you, Mr. Chairman, Ambassador, the High Commission of India to Nairobi, for chairing this and bringing out the issues that we are all grappling with very, very clearly. So I want to thank you, Excellency, Mr. Chabra. I would like to salute all of you, Excellencies, ambassadors, high commissioners, and senior officials from whichever part of the world you are listening to this webinar. And thank you for participating in it. I think I will echo my dean's quote of the Africa Day theme as silencing the guns, and say that while the continent had actually worked very closely towards achieving this, and I think that there have been some notable achievements on the continent with a few hotspots here and there, but basically it was moving towards it, and it would have mopped up everything. Well, then coronavirus started its own guns on the continent, and perhaps that's why we are all here. So I just want to concentrate on the two questions that have been asked by our convener. And I want to start by saying that Uganda-India relationship during this is divided into 3 sections. One prior to COVID, during COVID, and after COVID. Very briefly, I'll say that before COVID, we had high-level consultations in many areas, which culminated in ministerial meetings. We were working on a mechanism to establish collaboration between our drug agencies, especially in Uganda, in my country, Uganda. They wanted to collaborate with the counterpart agency, of course, bigger, with the wider responsibilities, the drug agency of India. Then before COVID, we had the private sector engagements in Uganda, between Uganda and India, where the private sector in India has gone to Uganda and established hospitals and established diagnostic centers, and is working on pharmaceuticals and the pharmaceutical industries. One of the most notable of these was the donation by the government of India of a cancer machine in our Uganda Cancer Institute, which was very well welcomed. This was done during the visit of the Prime Minister Modi. And then we had an NGO, a pharmaceutical company, donating a mobile cancer van throughout the country. That was prior to COVID. Then COVID hits us, and my president requests permission to talk to the Prime Minister of India because of the warm relations that exist between us. This call was made between the two principals, and the object of that call was solidarity, but more than the solidarity, the president actually made a request for some drugs to be sent to Uganda, which India obliged and sent us some drugs, for which we thank the country very, very much. But I think the discussion had gone further than that, the physical acquisition of the drugs. Uganda was thinking of being able to manufacture some of this COVID, especially the hydrochloroquine by itself. And so there's already an Indian company, Cipla, well established in Uganda, And so these resources were availed by the government of India to CIPLA to be able to manufacture hydrochloroquine on the ground. We thank you very much for this. Now, post-COVID in the health sector, I think that the high-level consultations on health issues should continue. Indeed, I would say that the health ministers should feature highly in one of the Forum Summit events, because there was defense ministers, then there was agriculture ministers, and I don't recall there being a meeting put in this summit, within the context of the summit for health ministers, and I think this is a very important area. Another very important area for Uganda in particular, and I feel very strongly about this, is that we wanted to establish a link between our drugs authority and the Indian drugs authority. This is because we have a very, very big problem of fake drugs entering our market. And some of our suppliers, will tell you this is for treating especially malaria, this is for treating this and the other, and the efficacy of the drugs, some of them were found to be zero. And we know that India produces better drugs and has the means to monitor the drug production, the people who produce these drugs and so on. And Uganda wanted to collaborate very much and still wants to collaborate with the Indian Drugs Authority. Then another area of research now, another area of collaboration post-COVID would be a very close working relationship with our virus institute in Entebbe. I think that Uganda has a lot to offer on the research that they have done on virology, because, for example, we dealt with Ebola, but also now we are seeing that India is much more advanced, has got much more advanced research capacity than us and technologies. So we want to form very close collaboration with us. Then we should also facilitate the private sector to set pharmaceuticals in Africa, if you like, but in the particular case of Uganda, in Uganda, there is no reason why we should not establish joint research between the formal conventional medicines research, as well as the Ayurveda, with some of the facilities and some of the resources that we have in Uganda. As you know, Africa has got its tradition of root medicine, herbal medicines, which goes centuries, and some of them are more effective than the others. And indeed, they are resources of some of the material for manufacturing drugs. So why don't we take this opportunity now to go into Africa, Uganda-India relation, Africa-India relationship, go into Africa and, like my dean said, locate there and do some research on African herbs and roots medicines. Now, I will talk about something else, which is which would be iconic, I guess, but not so iconic, in the sense that agriculture, in Africa, Africa has about 25% of the planet's land mass. And if our agriculture were unleashed and had the sort of revolution that has happened in other parts of the world, Africa, the planet would not need to worry about food at all, because Africa would supply the food. This also would be the starting point for a big industrialization program throughout Africa. And some of the African countries which have actually had their economies grow have grown from this industrialization of the agricultural sector, because the agricultural sector provides jobs for the youth, and the youth problem will be solved. Agricultural sector, when it's properly utilized, industrialized manufacturing, agro-processing, will produce for you credible quantities of goods in large quantities, which will supply not only the domestic markets in various countries in Africa, which will not only supply indeed Africa itself, it will be a food supply for the world, all kinds of food related. However, the green revolution that I'm looking for, we are worried a little bit about it, because we have learned a lot about how that revolution has been hijacked by some high companies, chemical industries, which produce chemicals which kill the soils. So we have had the advantage of looking at the green revolutions in other countries, indeed in India, how you attained it with your massive irrigation, massive fertilizer use, and so on, and farmer education and adaptation. You were successful in that. So we would like to learn, and if we were to move into that area, India would make a big impact, because the most important thing in a person's life, all of our lives, is food. And I think one of the items that we all were very worried about during the COVID experience was where to get the next food from. Unfortunately for India, it was in bountiful supply, but it could have been. Some people didn't have enough in some other areas. And so a revolution, Africa's green revolution, should be what we should focus on. Now, with this revolution comes the issue which my dean again talked about, domesticating some of your industries in Africa. Africa's agriculture is embedded with so many problems, but yet it is an agriculture which is dependent on old technologies. India has got a large array of agro-technologies which could be manufactured on the continent, and some of them could be reproduced for the particular circumstances, the soils and the land area and so on of the regions in Africa. So why don't we domesticate this on the continent? Last, let me touch very, very briefly on the funding mechanism. Now, our chairman talked about lines of credit, for which I thank him, but I think that we have to look at these lines of credit or the money that India is putting out to Africa with a lot of creativity, because some countries may not be able, all of us now are worried about self-reliance, and the issue about self-reliance, one of the issues around self-reliance is this fear of, being financially strapped, debts, foreign debts. So, and many of us are looking at it now. Now, on the other hand, we have a private sector, which India is famous for, which could take advantage of this money which India has for Africa and use it creatively to achieve the same goals in Africa. So while we're talking about lines of credit, I think one of the areas we'll need to look at in this post-COVID analysis of our relation is how we can actually get the money that India has for Africa develop and not make a loss out of it. Because I understand the principle is that if you give out the loan, you get some returns from that loan. I want to stop there, and I want to thank you again very much for giving me this time, and I hope I haven't taken too much of it. Thank you very much.
Thank you.